As we age, maintaining our health becomes even more important. Many seniors turn to multivitamins to help fill nutritional gaps and support their well-being. It's no secret that a well-chosen multivitamin can help provide the essential nutrients that our bodies need, especially as dietary needs change over time. However, there's something that often goes overlooked: the interactions between multivitamins and prescription or over-the-counter medications. Mixing certain medications with multivitamins can reduce the effectiveness of either the medication or the vitamins, or even cause harmful side effects. Understanding which medications shouldn't be taken with multivitamins is crucial for staying healthy and avoiding unnecessary risks. In this guide, we'll take a close look at which medications you should never mix with multivitamins, why these interactions matter, and what you can do to protect your health. Let's start by understanding what's in a typical multivitamin. Most multivitamin supplements contain a blend of vitamins and minerals, such as vitamin A, B vitamins, vitamin C, vitamin D, vitamin E, vitamin K, calcium, iron, magnesium, zinc, and more. Each of these nutrients plays a role in your body's functioning, but they can also interact with certain medications in ways that aren't always beneficial. The first category of medications to consider is blood thinners, also known as anticoagulants. These include well-known drugs like warfarin, also called Coumadin, and newer medications such as apixaban and rivaroxaban. Blood thinners are often prescribed to prevent blood clots, reduce the risk of stroke, or treat certain heart conditions. While these medications are life-saving for many seniors, they can interact strongly with vitamins, especially vitamin K. Vitamin K plays a key role in helping blood to clot. If you take a multivitamin that contains vitamin K, while also taking a blood thinner like warfarin, the vitamin K can actually reduce the effectiveness of the medication. This means your blood may clot more easily, increasing your risk of a dangerous event like a stroke or heart attack. It's not just about warfarin, though. Other blood thinners can also be affected, though the impact may be less direct. If you're taking a blood thinner, it's vital to check the label on your multivitamin for vitamin K. Some multivitamins are specially formulated without vitamin K for people on anticoagulants, but many standard products do include it. Always discuss with your doctor or pharmacist before starting or changing a multivitamin if you're taking any kind of blood thinner. Another group of medications to be cautious about are certain antibiotics. Antibiotics are used to treat infections, but some of them can interact with minerals found in multivitamins, such as calcium, magnesium, iron, and zinc. Two common antibiotics that interact this way are tetracycline and ciprofloxacin. Here's how the interaction works. These minerals can bind with the antibiotic in your digestive tract, forming a compound that your body can't absorb properly. This means the antibiotic may not work as well, and your infection could linger or get worse. To avoid this problem, doctors often recommend taking antibiotics and multivitamins at least 2 hours apart. That way, your body has time to absorb the medication before the minerals from the multivitamin enter your system. It's not just antibiotics that can be affected by minerals in multivitamins. Some medications for osteoporosis, such as bisphosphonates, are also sensitive to calcium, magnesium, and iron. If you take a bisphosphonate like alendronate, Fosamax, it's important to avoid taking it at the same time as your multivitamin, or with calcium-rich foods and supplements. The best approach is usually to take your osteoporosis medication first thing in the morning with a full glass of water and wait at least 30 minutes before eating, drinking, or taking any supplements. Thyroid medications are another common prescription among seniors. Levothyroxine, the drug most often used to treat an underactive thyroid, is particularly sensitive to interactions with calcium and iron. If you take your thyroid medication with a multivitamin that contains calcium or iron, your body may not absorb the medication properly. This can leave you feeling tired, sluggish, or experiencing other symptoms of low thyroid, even if you're taking your medication faithfully. To avoid this problem, most doctors recommend taking thyroid medication on an empty stomach with a full glass of water. Wait at least 30 to 60 minutes before eating breakfast or taking any other medications or supplements, including your multivitamin. If you're unsure about your routine, ask your doctor or pharmacist for guidance. Let's turn to heart medications, which are also widely used among seniors. Some heart medications, such as digoxin, lanoxin, can interact with high doses of calcium or magnesium, leading to changes in heart rhythm or reduced effectiveness of the medication. Diuretics, or water pills, which are commonly used to treat high blood pressure or heart failure, can also affect your body's levels of potassium, magnesium, and calcium. Taking a multivitamin that contains these minerals may help, but in some cases, it can lead to imbalances or interfere with how your medication works. If you're on heart medications, it's especially important to review your supplement routine with your healthcare provider. They may recommend specific supplements to address deficiencies, but taking a general multivitamin without medical guidance may do more harm than good. Certain medications for mental health, such as lithium for bipolar disorder, can also interact with multivitamins and mineral supplements. Lithium levels in the blood can be affected by sodium intake, and taking supplements that alter your body's balance of sodium or other minerals can change how your medication works. If you're taking lithium or any psychiatric medication, always consult your doctor before starting any new vitamin or mineral supplement. Let's not forget over-the-counter medications. Many people don't realize that common pain relievers and antacids can also interact with multivitamins. For example, antacids that contain aluminum, magnesium, or calcium can interfere with the absorption of iron and other minerals in your multivitamin. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and aspirin, can increase your risk of bleeding, especially if you're also taking vitamin E or fish oil supplements, both of which can thin the blood. Now, let's talk about the fat-soluble vitamins, vitamins A, D, E, and K. Because these vitamins are stored in your body's fat tissues, taking too much can lead to toxicity, especially if you're already getting enough from your diet or medications. For instance, if you're taking prescription vitamin D for osteoporosis, adding a multivitamin with extra vitamin D might push your levels too high, increasing your risk of kidney stones or other problems. Vitamin AA is another concern. Too much vitamin A can cause liver problems, bone loss, and even increase your risk of falls and fractures, an important consideration for seniors. Some medications, like certain acne treatments or weight loss drugs, can interact with vitamin A, making it even more important to keep your intake in check. Vitamin E, often found in high doses in some multivitamin supplements, is a powerful antioxidant but can also increase the risk of bleeding, especially if you're taking blood thinners or NSAIDs. If you take aspirin, clopidogrel, or warfarin, high-dose vitamin E supplements are best avoided unless specifically recommended by your doctor. Let's also talk about iron, a mineral found in some multivitamins. While iron is important for preventing anemia, too much iron can be dangerous, particularly for people who don't need it. Some medications, such as those used to treat infections, thyroid problems, or osteoporosis, don't mix well with iron. Taking iron with these medications can reduce how well they work, or cause uncomfortable side effects such as stomach upset or constipation. Seniors in the United States are also more likely to be taking multiple medications, a situation known as polypharmacy. The more medications you take, the higher the risk of an interaction with your multivitamin. That's why it's always important to keep an up-to-date list of all your medications and supplements, and to share this list with your healthcare providers at every appointment. What about herbal supplements? Many people take herbal products like ginkgo biloba, garlic, or St. John's wort for various health reasons. These can also interact with both medications and multivitamins, leading to unpredictable effects. For example, St. John's yibiuortiate can reduce the effectiveness of many medications, including those for depression, heart disease, and birth control. So, how can you stay safe while still getting the benefits of a multivitamin? Here are some key steps you can take. 1. Always consult your doctor or pharmacist before starting any new vitamin, mineral, or herbal supplement. Let them know about all the medications and supplements you're taking, including over-the-counter products. 2. Read the labels on your multivitamins carefully. Look for information about vitamin K, calcium, iron, magnesium, and other minerals that may interact with your medications. 3. Time your medications and supplements appropriately. For example, if you take thyroid medication or certain antibiotics, wait at least 2 hours before or after taking your multivitamin. 4. Watch out for high-dose supplements. More isn't always better. Taking more than the recommended amount of vitamins or minerals can lead to serious health problems, especially if you're already taking prescription medications. 5. Keep a list of all your medications and supplements and update it regularly. Bring it with you to every doctor's appointment and make sure each of your healthcare providers has the most current information. 6. Be aware of changes in how you feel. If you start a new supplement and notice new symptoms, such as unusual bruising, changes in heart rhythm, stomach pain, or confusion, contact your doctor right away. 7. Remember that food is the best source of most vitamins and minerals. Eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help you get the nutrients you need, often with less risk of interactions. 8. Ask about specialized multivitamins if you're on specific medications. Some companies make multivitamins without vitamin K for people on blood thinners, or without iron for people who don't need it. Your doctor or pharmacist can help you find a product that's right for you. 9. Be cautious with megadose or super supplements. These products may contain much higher levels of vitamins and minerals than your body needs, increasing the risk of interactions and side effects. Let's review some specific examples of medications that should never be mixed with multivitamins, or that require special timing. Warfarin, Coumadin, and other blood thinners. Avoid multivitamins with vitamin K. Tetracycline and ciprofloxacin, antibiotics. Avoid taking with multivitamins containing calcium, magnesium, iron, or zinc at the same time. Levothyroxine, thyroid medication. Avoid taking with multivitamins containing calcium or iron at the same time. Separate by at least 4 hours. Bisphosphonates, alendronate, risedronate. Take on an empty stomach and don't take with multivitamins or minerals. Digoxin, heart medication. Avoid high doses of calcium or magnesium in multivitamins. Lithium, psychiatric medication. Avoid supplements that can alter sodium balance. NSAIDs, aspirin, ibuprofen. Be careful with vitamin E and fish oil supplements. Prescription vitamin D, or A. Avoid high-dose multivitamins containing these vitamins. Ultimately, the key to staying healthy as you age isn't just about taking more vitamins. It's about taking the right vitamins, in the right amounts, at the right times, and always under the guidance of your healthcare team. Multivitamins can be a helpful tool for filling nutritional gaps, but they aren't a substitute for a healthy diet or proper medical care. If you have questions or concerns about your medications and supplements, don't hesitate to ask your doctor or pharmacist. They're there to help you navigate these choices and ensure that you get the best possible care. Remember, your health is precious. By staying informed and working closely with your healthcare providers, you can enjoy the benefits of modern medicine while avoiding unnecessary risks. Take charge of your well-being, stay curious, and never hesitate to ask for help if you're unsure about your medications or supplements. At Golden Age Health, we're here to support you every step of the way. Stay healthy, stay safe, and remember, you're not alone on your journey to healthy aging.